Hi, I'm Stroke Boy. Oh, my name's Paul. But now we're going to teach you on how to adapt to your new normal. One thing that's going to be hard to adjust to is probably a week or two, 3 weeks ago, you were doing everything normally, and now all of a sudden you can't get out of bed without assistance. You can't get dressed without assistance. You can't eat without assistance. Can't go to the bathroom without assistance. You can't take a shower without assistance. You're not driving, and hopefully not, but you may be completely immobile in a wheelchair. So this is our starting point, but this isn't where we're going to end up. So we're going to push hard and we're going to look at one thing at a time, focus on that, achieve our goal, and move on to the next thing, just like a math problem. We're going to take it one step at a time. It was very difficult for me to get dressed. I needed assistance for probably the first 3 months. And what I found was I got these Under Armour shirts, and if you got the 100% polyester, they slid over your skin easier when you only have one arm to put the shirt on. It takes a lot of practice. It's probably going to take weeks, if not a month or two, to learn how to put a t-shirt on, but you will get it. It will be difficult putting just a sock on. They have the sock threader, which I really didn't feel it worked very good, but it does assist you. And then trying to put everything else on. So be patient, take your time, work on one thing at a time, and it will get better. Another thing to do is if you do have an injured arm, shoulder, is wear the brace. Wear a brace that gives your arm free movement. In the beginning, you're not going to be able to put that on by yourself. You're going to need help. But over time, you will learn how to put it on by yourself. Getting in and out of bed is a chore. So if you don't have a hospital bed, if you get the bed rail, it makes it much easier, but it is still very difficult. And I put a pillow under my left arm to keep the arm at night from separating out of my shoulder. So it keeps it comfortable. So you will find all these things as you progress, what you need or what works best for you. And if you think of a trick that worked better for you, please share it in the comments below. Okay, showering, I'm sure they showed you at Rehab how to shower with a washcloth only, which is very difficult if you only have one usable arm. They showed you to put it on your thigh and then to soap it up and then to rub your arm with it to wash yourself. But unfortunately, when you're trying to wash the rest of your body, like your back, you can't reach everywhere with a washcloth. So what I did was I bought a loofah on a stick. So now you can reach behind your back, you can come around, and you can wash everywhere, and you can hold the loofah with your legs and then wash your arm. So this makes it much easier to take a shower. I highly recommend it, and I found this on Amazon. Another thing that will really aid you, you'll find out that you'll be exhausted after taking a shower. So what I did was I would use diaper wipes a couple times a week, and then I would take a shower a couple times a week. So that way you weren't in the shower every day, because if you did, I personally was completely exhausted, and the next day was rough. So that's what I would do. I'd break it up. The good news is you can probably still shave as long as you use an electric razor. It's going to be a little difficult because you're used to using both hands, but you only have one, but it can be done. Showering, you're going to need assistance. You're definitely going to need the shower chair if your stroke was as bad as mine. Okay, so brushing your teeth. I found that I have a Sonicare electric toothbrush. Doesn't matter what brand you get, preferably one that stands up, because now that you only have one hand, if you're as unfortunate as I was, you have to learn how to take the cap off of the toothpaste with one hand and then put the toothpaste on the toothbrush without holding the toothbrush. So it can be done, takes a little skill, but you will get it. Let's talk about driving. When I was at Rehab, I had to badger the staff to allow me to drive the driving simulator. They didn't want to do it. And after talking to several people that had strokes or traumatic brain injuries, they never did do the driving simulator. But I was amazed 2 weeks after my stroke how difficult it was to drive the driving simulator. First of all, my right arm had lost so much muscle that it was hard for me to hold onto the steering wheel and keep my arm up for more than about 5 minutes. And it was mentally exhausting trying to concentrate and do everything I needed to drive the simulator. So be patient. What I did was I bought a driving simulator and I was bound and determined to drive again. So I did the driving simulator at Rehab. I realized that that's about $100 or more per hour, and I probably wouldn't be able to do that every week because the simulator's booked. So, however, you can see how that will also be very expensive if you need a lot of sim time to get your arm strength back on the steering wheel, where I could only have like 5 minutes and my arm was actually burning in pain that there was no muscle left. So what I decided was I thought outside the box and I bought a driving simulator. So you could get an Xbox with, say, Logitech steering wheel that clamps on a desk and foot pedals below to retrain your brain and your arm to hold it up there, which you'll find is very difficult if you had a moderate or severe stroke like I did. Moderate stroke may not be so bad. But then you can retrain your brain and your foot on how to do the gas pedal, the brake, and have your leg move, and then the visual information that's coming in on the screen. It's going to be way cheaper if you do that because I took about 1,200 hours, and at $100, and my math's not that good, but I think that's maybe $120,000. We had 2 zeros, but for 1 year at 1,200 hours of time I put on my simulator. The sad part is the medical community says, and there's a study, that if you were driving before and had a stroke and it was mild, you will return to driving. If you had a moderate or severe stroke, unfortunately I had a catastrophic stroke, you will not return to driving. Well, I'm here to tell you that if you put in the work, you can return to driving. I'm currently driving now, and I'm driving up to 4 hours at a time. So it is possible. You have to be patient. You have to be cautious because stroke patients are impulsive after the stroke. So you really have to take care. But if you're patient and you do the work and you get approved by someone, when you get tested for your driving ability, you can get back to driving. I want to thank you for watching this video. Like and subscribe, and look forward to seeing you at the next one. Thanks for watching.